What types of hysterectomy treat reproductive cancer? When it comes to treating reproductive cancers, hysterectomy is a common surgical option. This procedure involves the removal of the uterus and can vary based on the type and stage of cancer. Let's explore the different types of hysterectomies that are typically performed for reproductive cancers, including cervical cancer. The first type is the total hysterectomy. This surgery removes the entire uterus along with the cervix. It is often the standard procedure for many cases of uterine cancer and some early-stage cervical cancers. In many instances, this surgery is combined with the removal of both fallopian tubes and ovaries, known as bilateral salpingo-oophorectomy, especially when there is a risk of cancer spreading. Next, we have the radical hysterectomy. This is a more extensive procedure that removes the uterus, cervix, upper part of the vagina, and surrounding tissues. It may also involve the removal of pelvic lymph nodes to check for cancer spread. Radical hysterectomy is typically reserved for cases of cervical cancer that have invaded beyond the cervix or for aggressive uterine cancers. This surgery is usually performed through an abdominal approach. Another type is the hysterectomy with salpingo-oophorectomy. This combines either a total or radical hysterectomy with the removal of one or both ovaries and fallopian tubes. This approach is common in treating ovarian cancer or when there is a high risk of cancer in the ovaries. It is important to note that removing the ovaries can lead to surgical menopause if it occurs before natural menopause. Lastly, there is the partial hysterectomy, also known as subtotal or supracervical hysterectomy. This procedure only removes the upper part of the uterus while leaving the cervix intact. However, this type is generally not recommended for treating reproductive cancers, as it may leave cancer cells behind. It is more often used for benign conditions rather than cancer treatment. Surgical approaches for these hysterectomies can include abdominal surgery, which can be open or minimally invasive through laparoscopy or robotic surgery, as well as vaginal routes. Abdominal surgery is more common for cancer cases, especially when additional structures like ovaries or lymph nodes need to be removed. In summary, total and radical hysterectomies are the primary types used to treat reproductive cancers, including cervical, uterine, and ovarian cancers. The choice of procedure depends on the specific type of cancer, its stage, and how far it has spread. Partial hysterectomy is generally avoided in cancer treatment due to the risk of leaving behind affected tissues. Patients considering a hysterectomy for cancer should have thorough discussions with their healthcare team about the extent of the surgery needed and its implications, including effects on hormonal status and fertility. Personalized treatment planning is crucial to ensure the best outcomes while maintaining quality of life. Always consult with a healthcare professional for tailored advice and guidance.